Good morning. Excuse the footwear. I left my Converse at the ward last night, so I actually look like a medical student. Clearly not a medical student, but hey ho. I'm just on my way to the hospital to see Georgia, but I just wanted to show you the actual route down there. So the hotel is about a mile away from the hospital, but look at that view. So that's the Shard, for those of you that don't know, and it is right next to Guy's Hospital. When I get closer I'll show you, but it's so nice. This walk is lovely at night because it's all lit up and there's little bars and things like that along the way, but I feel really safe. I actually feel safer walking than getting in a taxi, weirdly. But I'm getting my steps in. I've done, how many miles have I done so far? 7. And I've been here 2 days, so by the end of today I'll have done 11. That's just back and to the hospital. But yeah, that's good. So I'm just cutting through King's College, which is at the back before the entrance, and look how beautiful this place is.
So that's the stone in the right ureter that's blocking the right kidney down in the pelvis, and then this is the bigger one that's in the bottom of the left kidney.
Is that another one, or?
That's another small one as well. So measure it in this dimension, so 15 millimetres. So we measured it the other way and it was sort of 12 millimetres wide and it's 15 millimetres high. Yeah.
Gosh.
23, yeah. Yeah, so this is your post-op CT from May. You had no stone in your right kidney at that time, so you've grown that stone over 12 months. And actually that looks really clear on the post-op CT as well. That's the nephrostomy tube that you had after your operation on that side. You had a, looks like you had a CT January.
Yes, she did.
So let's have a look at that. Yeah.
Be interesting to see, won't it, when they started appearing, because then she had another one, I think, in May this year.
So January, you just had like the tiny stone there. Yeah, you got like a couple of really small stones. So, you know, so over, let's say, a 9-month period, you've grown that stone that's caused you the problem on the right-hand side.
Which is mad.
Yeah. And then on the left, I mean, there was quite a bit of stone there, yeah, on the left.
So the left is slightly bigger.
The left is much bigger. So yeah, so you see that's the stone that's dropped out, so that's grown.
Still looking for your nice size of vein and fine before we do
The IT.
I said that this morning.
Definitely not the IT team. The IV team have been today, and they have taken out the old cannula and they've done ultrasound on her arm, and they've managed to put a new cannula in. Now this should last 5 days. Fingers crossed.
It will, I'm making it.
Look at the bloody state of you.
That was all from
Oh my god.
this week and last week.
So because the ward George is on currently is a renal ward, they want her ideally on the urology ward, which is 1 floor down. So we are moving from this room to urology. So I'm just packing the bags up and going, and then we'll be on the other ward soon with an update. So this is George's new room.
And again, you'll have to live on the transporting. It's not even been 24 hours, so that's what's really annoying me. It's hard, isn't it? guy who came in to do my cannula, he was like, God, that is bad. And I'm like, I'm glad you see that.
Yeah.
Because I just see that as normal. I mean,
It's not okay, is it?
my hand's gone back to normal now, but even like the bruising on that hand.
Yeah, that isn't normal.
My hand's still fat from that.
It's not normal
cannula.
that they're trying to just flush antibiotic through that cannula and it's causing you that much pain.
Even saline.
The syringes are too big, it's too much pressure,
The
your
cannula's
veins could
too
blow.
big.
This,
They've done it before, haven't they?
and they can't just carry on, but you being you just sit there and put up with it, and it's not, you need to really say stop, because look at the state
I know.
you've got yourself into. And George has given me permission to film this. She wants you to see
Yeah,
how
yeah.
raw this is. I'm not
I
just
don't
being
show
cruel
it, do
and
I?
I'm filming her when she's upset. It's not the case at all.
I don't show this at all. Because
Georgia wants me to document this for her, so you guys can see, so we can use this as evidence.
this is why I should be in the children's.
Yes, she should be in the children's
Because they
ward.
wouldn't have done that in the children's.
In a cubicle. She's no threat to anyone else, safeguarding. She needs paediatric care, and it's as simple as that.
20 ml syringes, and I've got like a massive cannula in my hand right now, and that's adults, so it's in my tiny vein. So that's why this is causing me so much, and it's not even been 24 hours. It's been what? Just over probably like 14 hours,
Yeah.
maybe.
And this is meant to last 5 days, and you can't afford this one to pack up because you can't go into that other arm now because you've got no veins left there.
Yeah.
They're healing from the other cannula.
Yeah.
Oh, God.
It's hard. It
So
really
hard
is.
for you.
Especially when it's been so long, putting up with this in like 2 weeks.
And I'm having to sit here and say, no, enough's enough, but George is an adult, so Georgia has got to stand up and say this herself, because she's the patient, and she's so, she just sits there and puts up because she is one tough cookie, but her pain threshold is off the scale. So when I see her like this, I know this is unbearable for her, but she never lets it show. And the nurse has just gone off now to speak to somebody, because obviously we need to get the anaesthetist or the IV team back to check. There's nothing going on there, so we're just getting off the ward for what, 20 minutes, half an hour. There's a little WH Smith's M&S, and then I think there's a super drug, isn't there, in the shard, she said. So you're just going to go and have a little look there for some toiletries you need.
Yeah.
We've got the mask on to protect the patient. Let's go and get some fresh air.
I'm so happy.
Fourth floor. Hospital snacks.
Wow, yes. That's good, isn't it?
Isn't it? We're back from our
That's lovely. That.
20-minute adventure, freedom. So it's next to the Shard, isn't it? It's the London Bridge underground station. There's like a little tiny shop, like a few shops there. There was a super drug, an Itsu.
That's it.
Oh my God, the Itsu. Never been in an Itsu. I'm going back.
I can't believe Mum's owning it. It's amazing, but I don't get to go because no one goes in it with me.
It looks so nice, like the salmon things. Oh,
They have gorgeous like sushi rolls, but I love gyozas. We get the
those
frozen-
dragon salmon sushi rolls looked amazing, didn't they?
I'd
I
have
might
a
get that
bite
for my
of
lunch
yours.
tomorrow,
Well, there was only one left. There wasn't much left because it was really late.
Yeah.
But
It was getting quite busy as well. I was conscious that you were out there. You had your mask on and everything, but I was like...
These are gyozas, so they're nice and soft, which is what I need, soften it. Because my mouth is just so... I don't enjoy anything at the minute. So these are like...
I'm just glad that you've got a little bit of...
Well, not any. I don't know. There's nothing.
You've got excited about that, so that's good. Because you need to eat and obviously keep drinking to get your blood pressure back up, so...
Yeah.
So, Georgia got... Hospital essentials. Triple pack of cotton pads, £3. Jacobs, honey and lemon lozenges.
Did you get a dry throat when you've had to spend 2 weeks on a shaving?
Antiseptic wipes.
Oh, put them in here actually.
Lip balm.
So it's
Cheeky little
Oh,
pumpkin spice shower
so
gel.
I've no
Because it is officially autumn.
It's October.
Some talc for the creases.
Oh, talc really helps.
Yeah, you
Because
get.
I'm so swollen.
Yeah, my legs are really swollen at the moment, aren't
Because
they?
my kidneys aren't work. I've got 2 kidneys that don't work. Yeah, and a lot of builds up from my legs and I need the talc. I bought this because I'm having surgery on Monday, and after it, I end up having basically an open wound. You need. It's horrible. It's not. It did traumatise last year.
Not the crying eye.
Oh no, it's not nice. And we needed Savlon, and it really helps. So I bought one for myself because you end up with a hole in your back after this surgery.
Yeah, you
Lots
do
of
actually.
dressing
Yeah.
changes. Someone's going to be on this
I will. I'm
for
an
2
expert.
weeks again.
And a little deodorant for little
needed-
pits. Oh, I'm glad you like that. That was just a nice 20
yeah,
minutes,
that was
wasn't it?
nice, yeah.
And you've had something to eat,
And I've
so.
now got to get my just changed. I've got to my kidney drain changed, like just the dressing bit.
It's in like a Velcro locked pad, isn't it? So it's its own like little
No, but
protective.
it's just the fear of the move.
They won't move it. No. They won't. They'll be really good.
It's not nice, kids.
George is too nice, and she won't say when she's in pain. She'll be like, "It's fine." And actually, before, as you could see, there was tears.
If I didn't have this dream, I wouldn't have a kidney right now. Because that was the scary
Yeah.
reality of it.
The reality is,
We didn't
yeah,
know-
that's
we
why they
didn't
put the
even
drain
tell
in.
the
It would have been
block this,
kidney failure would have kicked in very
Yeah,
quickly.
One of the the main nurses just said, didn't she, about if I didn't have the drain,
Yeah.
the kidneys would have gone into a failure. And
Yeah.
I've got 2 non-working kidneys at the
So
minute.
she's been told off because we really probably should have gone in hospital sooner than we did.
But it's my fault.
But she puts up with the pain. That was scary because obviously that was a new pain, wasn't it? So anything new.
It's quite a reality check.
And the nurse in charge said, you will know because it's like a pain that you've never had before. And Georgia said, it's like a pain I've never had before.
See what I mean?
Anyway, stop waffling. I'm going for my dinner.
I know I was getting a lovely dinner.
I go to the hotel now
But she
and I get a
deserves-
lovely dinner and breakfast included. But it's
People
nice,
know it.
yeah. So there's a little beef eater bar thing
Yeah.
next to the hotel. And they're really nice in there. Lovely food and you get dinner and then the breakfast. Thank you, ASOS. I love you.
ASOS,
That
thank
is
you.
such a dream to go back
I
to at the
know.
end of the day after
What
sitting in here
angels.
and then
It's
it's
a long
always quite
day.
stressy every day, isn't it?
Yeah, it's
Someone's
quite
in and out, in and
overwhelming as
out.
well.
You don't even have to, Georgia doesn't even have time to have a nap because
Yeah.
somebody is in. And that
Checking the
is
blood
is
pressure.
fab that they're in every 5 minutes because they're doing the job and checking
But
everything.
sometimes they chat as well, so it's hard to.
But you've not been able to rest, have you?
No.
Then I go for my tea and then I'll come straight back and then we get
You're
about,
tired.
well, we get an hour and it's our Philip Schofield hour.
Yeah, we've got
And
half an hour left.
we've got the last one tonight. Oh, half an hour left
Yeah,
because we watched our,
forced it last
oh,
night.
what a shame.
As soon as one got to the hotel on the map, I died. Quite literally.
Yeah.
About 10 minutes.
So
and
we'll have
then-
to find something else.
Yeah.
So
Well, that's the plan for tonight.
that's the plan for tonight. So you should get like a nice, well, hopefully a bit more chilled weekend. Tomorrow's Saturday.
Yeah.
Chilled. You're here now. You're settled here.
Yeah.
And then Sunday, ready. Hopefully,
Let's go.
find out what time you're going down, morning or
Probably
afternoon
morning.
on the Monday.
Yeah, they always get me in the morning, which is great.
I think you'll meet Mr. Glass, guys. He's lovely.
4 hours in recovery.
Did you vlog last year? No, we didn't. He wasn't on cam last year, was he?
No.
We'll try and get him on cam because he's the
He
god.
would be lovely.
He's the god
to
of
be
kidney
honest.
stones.
I mean, he would because he's such an amazing man.
Yeah. That whole team are lovely, aren't they?
Yeah.
Really lovely. So yeah, we'll keep you updated and it is what it is till it isn't. We've escaped. We've been allowed out for just about 2 hours.